Okay, so the question is asked, what is my favorite scar therapy or scar gel? Well, the answer is that it's not a gel. My favorite scar therapy is tape. So the story behind tape is this. I had a patient who came in and had a breast reduction, I believe. And this was about 5 years ago. And back in those days, I would put tape over the top of the reduction, and then I'd ask him to come in a week later. I'd take the tape off, and then I'd give him an expensive bottle of scar gel. Well, this person didn't come back for their 1 week appointment, which is uncommon. Almost everybody does. But she didn't come back. And so she came back at 6 weeks, and she still had the tape on. And I was like, ooh, 6-week-old tape. And I took the tape off, and her scar looked magnificent. I thought I was a genius. I thought I had discovered the value of tape in the world of surgery, and I was going to tell the world about it. So I started researching whether I had in fact discovered this, and it turns out I did not. We've known it for like 75 years that tape is great for scars. The reason we don't use it very often is, I think, probably just an accidental bias. Tape costs like 18 cents for a roll, and scar gel can be expensive. And there are companies who have salespeople that will call surgeons' offices a couple times a month and say, hey, you should consider our scar gel. Nobody calls and says, hey, you should consider our tape. So we probably accidentally moved to more expensive products that, in my opinion, don't work as well as tape does. So all of my surgical patients, or almost all of them, I ask them to wear tape on their incisions for up to 6 weeks, and even longer if they will. And that tape seems to have helped the scarring process dramatically. So I'm a big advocate for it. Now, when that tape comes off, that's the time where we can use a product. And there are a couple of different products. One is a store-bought kind, an over-the-counter remedy like Mederma. I'm not a huge fan of Mederma. It's fairly expensive, and the results on it are not dramatic, and so I'm not a big advocate for it. The other end of the spectrum is a really expensive product like Embrace. That's silicone tape. Silicone tape probably works better than anything else does, but it's got a huge cost attached to it. And if your scar's doing fine, that cost isn't likely to add any benefit. The next step down from that is probably FDA cleared or FDA approved scar gels, things like Skin Medica's scar gel, which I use a lot of, or Biocorneum, which is nice because it has a sunscreen in it. And then the step below that, for people who either don't want to pay for the pharmaceutical stuff or don't want something from a pharma company, they want something more all natural, is Scar Salve, like Eden's Scar Salve. Now, as it regards which of these to choose, well, that's a personal thing. And maybe it's personal between you and your doctor, maybe it's just personal between you and your goals and your desires. But the end of that conversation, or the end point of that conversation, is probably that most of these things work. Most of them provide some benefit. They may be different benefits. And which one you choose is almost entirely up to you.